More cases of a gut-wrenching illness that is caused by a parasite that may be found in raw vegetables and fruit. There's a lot of uncertainty around that. That's why I say may. There are new numbers that have just been released, and they show that there are now more than 3,000 cases in Michigan and Ohio, which are the hardest hit states, most of them in Michigan. We have CNN health reporter Jacqueline Howard joining us on this. Jacqueline, this story just really seems to balloon here. Tell us more about the people who have gotten sick and some of the uncertainty around all of this.
That's right, Brianna. We're seeing more and more cases emerge. And what we know about the people who've gotten sick, some of them have been hospitalized. When you look at Michigan alone, where there are now more than 2,600 cases that have been reported, 44 of them have been hospitalized. And when you look across the country, there have been dozens more hospitalizations as well. In total, Brianna, 31 states across the country have reported cases, but not all of those cases that we know so far are connected. These cases are still under investigation, and currently the only cluster of cases that has been described as an outbreak are those cases in Michigan as well as some in Ohio. And the reason why it's really difficult, Brianna, to pinpoint, okay, what's the original source of this outbreak or of these clusters is because once someone becomes infected, it can take anywhere from 2 days to 2 weeks for symptoms to emerge. So health officials, especially those in Michigan, are really scrambling to identify the source of these cases. And the symptoms that cyclospora infections, which is called cyclosporiasis, the symptoms of this illness include watery diarrhea. In some cases, it's described as explosive diarrhea, Brianna, as well as loss of appetite, cramping, bloating, nausea, fatigue. These symptoms can lead to dehydration, and for some patients, it's dehydration that has led to them being hospitalized. So it's really important, Brianna, to be mindful of how you can even become infected. A lot of infections sometimes are tied to contaminated fresh produce or contaminated water, like from water parks, or if you're eating fresh produce. So it's really important to wash your fruits and vegetables because this illness can be miserable. I'm telling you, Brianna, a lot of people want to avoid this altogether.
Okay, so talk to us about washing fruits and vegetables, because the pictures that we're looking at here, I think, is how a lot of people do it. They run their fruit or vegetable underneath a stream of water. Maybe they're trying to make sure they clean the surface of it. I mean, is that enough? Is there a soak? Do they need to use some kind of additive in the water? What can we do?
Yeah, so water is better than nothing, but to really be more effective with cleaning your fruits and vegetables, you can add a little bit of vinegar to create a vinegar rinse. So what you want to do, mix 1 part vinegar with 3 parts water in a large bowl. Put your fruits or your vegetables in there, make sure they're covered with this vinegar rinse, and then physically stir your fruits and vegetables around in that water. And even, scrub or rub those fruits and vegetables to really make sure you're physically cleaning them off. And that can help really, really make washing your fruits and vegetables more effective with reducing your risk of getting sick in the first place. So try that out, and Brianna, that is more effective than just water alone.
Dr. Redfield, how serious is this illness, and what sort of food should we be avoiding right now?
Well, it can be quite serious, and then it can cause severe dehydration if it's not treated in terms of maintaining your hydration. Luckily, an antibiotic that we know as Bactrim or Ceftra does have some positive impact, so it is partially treatable. But it can be a quite uncomfortable gastrointestinal pathogen. It's a parasite. It can really last anywhere from 2 days, 2 weeks, and even longer into even a month with severe diarrhea, gastrointestinal disturbances. The foods that we associate it with largely are fresh vegetables and fresh fruits. We have had outbreaks in this country secondary to cilantro, to basil, to snow peas, to raspberries, to lettuce. The challenge we have is that there's no real reservoir for this. The reservoir for this pathogen is actually human feces. So it's a subject of human contamination in water and in the foods that we eat. It does get killed by heating to 158 degrees, but it is hard it's a sticky little parasite. And so when you wash your vegetables, it doesn't necessarily always wash off. So, obviously the safest thing is to eat cooked vegetables, cooked fruit. But it's quite significant outbreak right now we have in the United States. It's in 31 states. We've had no deaths. We have had, 80 something 86 hospitalizations, I think the last I checked. But it can make you severe diuretic. It's a bigger problem for immunosuppressed patients with HIV infection. They can have bouts that will last longer, even months.
Wow. So what should you do then if you think you're sick with this parasite?
If you do think you have it, you developed, diarrhea, abdominal bloating, abdominal discomfort. It's not a bad idea to see your physician because they can actually treat you with a drug called Bactrim Receptor if you're not allergic to sulfa, and that can alleviate your symptoms much quicker. Unfortunately, there's not a lot of good alternative bacteria. Some people there's one study that I think was done, only one study that suggested maybe ciprofloxacin was effective, but it really wasn't a very good study, and I don't think the data is very clear. So I really think the only antibiotic that I have any confidence that may have any benefit would be Bactrim Receptor.
Last year, Dr. Redfield, the CDC actually scaled back a decades-long federal-state partnership that monitors foodborne illnesses, including those caused by Cyclospora. The move no longer requires authorities to report it and other pathogens to the Foodborne Diseases Active Surveillance Network known as FoodNet. How do those cuts to the agency impact the response to outbreaks like we're seeing right now?
Well, it's harder to identify them. I mean, the key to public health response is pathogen identification. When I was CDC director, I really thought we had a very good program that could really pick up foodborne pathogens pretty quickly in partnership with the FDA. So I don't think it's in our country's interest to cut these programs back. Surveillance is sort of the key to early identification. The problem with the cyclosporin outbreak is since it may take 2 to 14 days, even longer to a month to get symptomatic, it's really hard to identify source. So right now, even though it's in 31 states, unlike most foodborne outbreaks, well, we don't know the source. We don't know if it's lettuce. We don't know if it's cilantro. We don't know if it's basil. We really don't know the source. And that makes it even more problematic to try to contain the outbreak.
Can we start with just what makes this different than other foodborne illnesses?
So it makes it different in that we still haven't been able to track where it's coming from. So unlike many infections, this is not transmitted from human to human. Yeah. The more likely place that we get it is actually from our food source, and it's the fresh fruits and vegetables. The main thing that people like me as a cardiologist are telling people to consume.
Right.
It's on fresh fruits and vegetables. These are little parasites, what we call the oocytes, the little eggs that then can get into your body and begin to develop and create more and more what we call havoc in the intestines, also known as diarrhea.
Mm-hmm. And so this is the time of year. I mean, you should be eating fresh fruits and vegetables
all
year
time.
long.
That's correct.
But this is, the summer brunchy time. You have your, fresh fruit salads and all that. Are you suggesting, let me back up before we get there. How do people treat these? Of course, you should wash them.
Right.
But should we stay away from fresh fruits, have only cooked vegetables and fruits right now?
Right. Or are you saying, Dr. Morgan, do you recommend an ice cream summer and just avoid the fresh fruits and vegetables? So listen, let me just say, washing them actually doesn't remove all of the parasites.
Oh, no.
This is a part of the challenge. It can certainly decrease the number, but it's not foolproof. So what would we recommend? If you have lettuce, peel all the outside layers off. If you have fruits and vegetables and you're able to peel them, peel the outside layers off, because washing certainly helps, and it's a really great hygiene to follow, but it doesn't actually get rid of all of the parasites of cyclosporiasis, unfortunately.
And the parasite is resistant to bleach. So when we're going to the public pool or to the water park or these splash pads, it could be there as well, right?
Certainly, we can find it in pools and water sources. And also, you know, part of the reason that we find it in water sources is it's spread by something we call fecal oral route, which sounds disgusting.
It does.
But we sort of, you know, eliminate it in our waste, and then it gets into the food supply. So it's not passed from person to person. We get it in our food supply as it passes through our body and waste, unfortunately.
So watch out for the fresh fruits and the pool.
I know, unfortunately. That's terrible advice from a cardiologist.
No.